So, good morning, everyone. Thank you for attending today's public hearing on the Older Americans Act State Plan on Aging for Maine. This is the second of the public hearings, so the two of two. We had the first one on Tuesday at the same time, and that was attended pretty well, and so that was great to see. So before we get started, I would like to do some introductions. My name is James Moorhead. My pronouns are he, him, and I am the Healthy Aging Services Manager here at the Office of Aging and Disability Services. Here with me today, we have Karen and Elizabeth. Karen, would you like to introduce yourself?
Sure. Thank you, James. Hi, everyone. Good morning. Thank you for spending your time with us today. My name is Karen Mason. I'm an Associate Director here at the Office of Aging and Disability Services, and I oversee the Healthy Aging and Long-Term Supports and Services programs. And we are very excited to have you listen to James' presentation this morning, and we hope you've had an opportunity to review the draft, and we look forward to your comments today. And I will turn it over to Elizabeth.
Good morning, everyone. My name's Elizabeth Gatteen, and I help to coordinate the Governor's Cabinet on Aging, which I will talk about very briefly in a few moments. But really, I just want to welcome everybody and thank you all for joining this call. James?
Great. I'm unmuted. Great. Thank you both, Karen and Elizabeth, for doing those introductions and joining us today. Today's agenda, we are going to provide a brief introduction from the Governor's Cabinet on Aging, so from Elizabeth, and speak about the cabinet and what their priorities are and what work they're currently doing and what's on the horizon. After that, I'm going to provide an overview of the Older Americans Act programs and services in Maine and what does that look like across the state and who are the players. After that, I'm going to provide a summary of the Maine State Plan on Aging, which can be found online, and we will definitely provide links to that in the chat, to both the links to the summary of findings and the draft of the state plan as well. After I have provided a summary of what is contained in the State Plan on Aging, we're going to open this up for public comments from everyone that's attending today who would like to provide those public comments. A couple housekeeping notes. Please remain muted until the public comments portion of the agenda. This will help reduce that background noise and make sure everybody can hear what's being presented. So. Thank you, Karen, for monitoring the lobby and letting people in. So with that, there's another housekeeping as well. So how can you submit public comments on the proposed state plan on aging? There are really two ways you can do that. First is you can provide written comments and you can submit that directly to my email address, which is listed on the slide on the screen today. That is james.moorhead@maine.gov, and Moorhead is spelled Moorhead. ODES will be accepting written public comments until May 17th. So if you haven't had a time to look over the State Plan on Aging, or you're still continuing to go through the State Plan on Aging, it's quite a lengthy document. We will definitely welcome those written comments until then. If you've had a chance to go over the State Plan on Aging and you would like to, you can provide public comments in today's public hearing one of two ways. You can do that through the chat feature of the Teams meeting. You can also do it during the public comment portion of the agenda and take yourself off mute, and we will be taking notes on what those public comments are. We do have a captioner with us here today as well. So if you need captioning, that is also available as well. It is very important to understand that we will not be providing comments or responding to questions that are provided during the public hearing today. Instead, formal responses will be provided in the final version of the State Plan on Aging when it is posted on our website. With that, I would like to turn it over to Elizabeth for her portion of the agenda.
Thank you, James. And again, thank you all for being here. We're here to talk about the State Plan on Aging, but I think it might be helpful to put this work that James is going to be talking to you about, that we're here to talk about today, into the broader context of how does that connect to some of the other work that is happening in the state, and specifically around where does this fit within the work of the Cabinet on Aging. And I do want to thank James. I want to thank Karen, the Office of Disability Services, the Cutler Institute, who did some of the needs assessment work that James will be talking about that led into this state plan. And most importantly, all of the people who have provided input along the way, including you all here on this call today. It is very important that we hear from everybody as we go forward with the planning that we do to be sure that we meet the needs of older adults and that we can all age comfortably in the state and make Maine a great state to grow old in. So I just wanted to very briefly mention the Cabinet. My part will be very short. And many of you may know, but just to be sure everyone is aware, that the Cabinet on Aging was established by Governor Mills really to elevate the voices of older adults and to advance policies and programs that help ensure that we can all age safely, affordably, and in the ways and settings that best meet our needs, what we all want. And basically, the Cabinet is made up of the leadership of 8 different state agencies. So essentially, the commissioners of 8 different state agencies. It is co-chaired by the Commissioner of the Department of Health and Human Services and the Commissioner of the Department of Labor. They co-chair, and there are many other state agencies. And really, it is to break down the silos of state government to be sure we are talking across the state and across agencies and coordinating policies and programming, whether that be in the areas of housing or transportation or human services, looking to really have that those conversations, that coordination, and that partnership. And the ongoing work of the Cabinet is rooted in the principles of inclusion and equity, and that Maine benefits from the involvement, experience, and knowledge of older adults in every aspect of our community and our economy. So really elevating the voices of older adults, being sure we are visible, we are seen, that our contributions are recognized, and that the needs that we all have are met in our own unique ways and needs that we all have. So James, if you just want to move to the next slide, this is the only other slide I have. I just wanted to mention the key focus areas of the Cabinet, which are intentionally broad because there are many strategies and activities within each of these. But the really 3 focus areas that the Cabinet works on are really to create sustainable living. You know, we want resilient communities now and for the future that are safe, where people have the services that they need to age comfortably. So much of the work is there. We obviously cannot achieve that or make progress in that area without supporting community connections that really improve quality of life, inclusion, connectedness of people to communities, to Maine. Very important piece, and a place where the Cabinet is doing a lot of work. And then engaging older adults in active retirement and work, and ensuring that the contributions of older adults, the values of older adults are reflected, and that we have age-inclusive society and communities and employment settings for all of us. So those are some of the things that the Cabinet works on. As you hear from James, and James is going to really talk about the State Plan on Aging and the programs and services under the Older Americans Act. those are really foundational pieces to the larger work that the cabinet is engaged in. So we obviously do not duplicate work. We very much work closely with the work that James is going to be talking about within the state plan to be sure we leverage that work, we build on that work, we elevate that work, because I think you're going to hear from James as he goes through the state plan and the goals, the strategies. There's a lot of alignment, and we're all working towards the same thing. And so I would say that the work that James is talking about is really one of those building blocks, those foundational pieces for the work of the cabinet that we can then build on and continue to advance in other ways. So James, I'm going to turn this back to you, but I just will say again, your input is so valued, and I will put in the chat a link to the webpage for the Governor's Cabinet on Aging, and we recently issued a report where you can read much more specifically about some of the activities, and you will also see after James does his presentation, you would be able to see quite a few linkages between that work and the work that James is going to now talk about. So I'll turn it back to you with just, again, a big heartfelt thank you for being here, being involved, and learning and including your voice in this work. So thank you, James.
Thank you so much, Elizabeth, for providing an overview of the Governor's Cabinet on Aging. So now I'm going to provide an overview of the Older Americans Act services and programs in Maine. The Older Americans Act is administered by the U.S. Administration for Community Living. You'll often hear me refer to it as to ACL. We love acronyms. So ACL stands for the Administration for Community Living. They are the federal administrator of all grants. There are 56 state units on aging. State units on aging are designated and also in the inhabited territories in addition to the 50 states. So the territories like DC, Guam, U.S. Virgin Islands, Puerto Rico, Samoa Islands, they also have they have designated state units on aging. And each state unit on aging receives federal grant awards from ACL to administer a state plan on aging and also to deliver services and programs that are funded by the Act. In order to be eligible to receive those grant funds, each state unit on aging must submit a state plan on aging. Our state plan on aging for Maine is on a 4-year cycle. So our current state plan on aging ends on September 30th of 2024. And the proposed state plan that we're going to be talking about today starts on October 1st of 2024 and goes through September 30th of 2028. The Older Americans Act is a formula-based grant, meaning that it is largely population-based. Because Maine is one of the least popular states, we're like 20, I forget the number, but we are almost flat funded in terms of the amount of funds that we receive under the Older Americans Act because Maine only has 1.3 million people in the whole state. So I think that's an important understanding. There are states like New York, California, Illinois. They get a lot more Older Americans Act fundings because they have a lot more people. The state plan on aging is viewed as a grant application for these grant awards that outlines goals, objectives, strategies, and outcomes for each state. And if that state has area agencies on aging, which Maine does, it outlines the actions and the goals and strategies that the aging network is going to take in the next 4 years to serve older adults and their family caregivers. Another really important distinction about the state plan on aging is that it is focused specifically on the programs and services funded by the Older Americans Act, but understanding that it is a piece of the larger puzzle in terms of the services and programs offered. So services that are authored by our Maine Care, our Medicaid waiver programs, and our state funded programs, those are not necessarily part of the state plan on aging. Those strategic plans live elsewhere. So I just want to make everybody clear that what's contained in the state plan on aging is really narrowly focused on the OAA programs and services. But that doesn't mean there's going to be a topic area about integration with, and back to Elizabeth's point, is understanding what role does the Older American Act services and programs play in the larger picture, and how do we work together. The Older Americans Act was enacted in 1965 at the same time that Medicare and Medicaid was enacted. So this was really viewed as a way to ensure that older adults had access to a coordinated, comprehensive system of care. The Older Americans Act has been amended, I think, 16 total times over the years, with the most recent being in 2020. And there are talks on the Hill. They're already starting the process about the next reauthorization of the Older Americans Act. So throughout the years, there are certain pieces that are added or modified to the Older Americans Act. So what we see currently today was not what the act looked like in 1965. But what it does look like today is there are 7 titles of the act. We really start with Title 3. This is the lion's share of the funding that Maine receives. And Title 3 is broken up into 4 subparts. We receive 4 unique individual grants, one for supportive services, one for nutrition services, evidence-based programs, and care partner services. Under each one of those categories, you'll see those large buckets of service. So under supportive services, we have access assistance, in-home assistance, and legal assistance. We're going to talk about that a little bit later. Under nutrition services, we have congregate meals and home delivered meals. There are other services under nutrition services like nutrition counseling and nutrition education. Evidence-based programs are those services like Tai Chi, Matter of Balance, chronic disease self-management programs. There's the chronic, they're geared towards more chronic conditions and how to manage those and also prevent them as well. Title 3E is a relatively new one compared to the others that was enacted in 2001, and it provides funding for caregivers of older adults as well as older relative caregivers caring for individuals, adults with disabilities who are their children, as well as minors. So think about grandparents raising grandchildren. We often call them kinship caregivers as well. From there, Title 4 is discretionary grants, where ACL will award competitive grants to through a competitive process for things like expanding evidence-based programs. This is also where a lot of the technical resource centers are funded on the national level, and there are a variety of technical resource centers funded by Title 4. Title 5 is the Senior Community Service Employment Program. These funds, and I'm going to touch on it a little bit in the next slide, is for low-income older individuals who are 55 plus who are unemployed, and it provides job skills training to help them get back into the workforce. Title 6 is the Native American programs. These funds are directly for tribal organizations that are eligible to receive those funds to help serve tribal elders and their care partners. And Title 7 is vulnerable elder rights prevention activities. There are 2 parts to this. That is where we get funds for our ombudsman program and funds for our elder abuse program, which is adult protective services as well. So there's a lot of grants, and the Older Americans Act is pretty expansive, and so yeah, hope that provides a little bit of breakdown of what form does Maine receive the funds in. This is really important to understand because when we talk about the goals and the objectives and strategies a little bit later, those are speaking directly to the services that are outlined in each of these subparts, which again goes back to the state plan is really viewed as that grant application. So what does Maine's aging network look like? So we start at the top. That's where you see ACL, the Administration for Community Living. They're the federal grantor. They administer the grants on a national level. They provide grants directly to the Department of Health and Human Services, specifically the Office of Aging and Disability Services. But they also provide grants directly to Title VI grantees. There are 5 tribes in Maine that include the Passamaquoddy of Indian Township, Passamaquoddy of Pleasant Point, and the Holton Band of Maliseets. Those have combined into one consortium, and that consortium receives the Title VI grants. There's also the Penobscot Nation as well as the Micmac Nation. Those 2 tribes receive grants directly as well. Under the Older Americans Act, we are charged with coordinating services with our tribal partners in the state. So that if you go read through the proposed state plan, we outline how we propose to do that. As I mentioned earlier on the previous slide, the Department of Labor administers the Title V CSIP grants, and ODES also receives grants to administer that program in Cumberland, Lincoln, and York counties. And once again, there is a state plan requirement that we coordinate between Title III and Title V services. From there, the ODES issues a series of contracts using these grant funds to all of the partners that are listed on this screen. So we have a contract directly with Legal Services for Maine Elders. This is the statewide legal assistance provider that provides that legal assistance to individuals 60 plus. We also have a contract with the Maine Long-Term Care Ombudsman Program, who help individuals both within long-term care facilities and advocate for their rights, as well as those who are receiving home-based care. And then we have the large amount of funds, the Title III funds, is awarded to the 5 area agencies on aging. That includes a Rustic Agency on Aging, Eastern Area Agency on Aging, Spectrum Generations, Seniors Plus, and the Southern Maine Agency on Aging. We are required to have matching funds, so we have to include some state funds to match the federal funds. So in the contracts with the 5 AAAs, we included those state matching funds. And the area agencies on aging are also required to come up with the local sources of match. So the services and the programs that are funded and delivered, they're funded through both federal, state, and local funds. And from there, the 5 area agencies on aging are charged with contracting with local service providers. So an individual may be receiving a similar service, but from different providers, depending on where you live in the state, and it also depending on how the AAA is structured as well. So similar services, the same services, but it's delivered slightly different depending on the needs of the area. Also to the right, you'll see that the Maine Council on Aging is listed. They are also an extremely valuable partner in this. While we don't award grant funds directly to the Maine Council on Aging, they are part of the advisory committee, which I'm going to talk about, and they serve as that advocacy voice for older people in Maine. And they're really good partners to help advance the needs of older people in Maine. So the service areas, so part of the state plan on aging requires states to outline what is called planning and service areas. So for each of the 5 area agencies on aging, here you'll see which counties are covered by which AAA. And also to the right is the contact numbers for the aging and disability resource centers that are established as part of each of the area agencies on aging. These are really those good first first contact points. If you know someone or you are looking for services and programs in your area, please contact your Aging and Disability Resource Center, and here are the contact numbers as well. The 5 area agencies on aging also are come together and form the association, the Maine Association of Area Agencies on Aging, and this is their membership organization as they work together as a group. So as I mentioned earlier, the Maine Long-Term Care Ombudsman Program and Legal Services for the Elderly provide ombudsman and legal assistance services respectively across the entire state of Maine, but they are both headquartered in Augusta. And there's also contact numbers for the ombudsman program, and I got to update that one. Legal Services for Maine Elders. How did we get here? The effort involved in developing the state plan on aging, it started last year in July. So it's taken almost a whole year to plan, develop, and go through the approval process to get an approved state plan in order to continue to receive the Older Americans Act funds. Back in July of 2023, ODES convened an advisory committee consisting of both internal and external stakeholder groups. There's, I think, a little over 20 individuals that were part of the advisory committee. And we started with the needs assessment. So the advisory committee provided valuable input about what questions we want to ask, what information are we seeking as part of the statewide needs assessment, which is it is a requirement of the state plan on aging that states conduct a needs assessment to help inform those objective strategies and outcomes. So we convened in July. We came to an agreement about what the protocols and what information we wanted to collect as part of the Maine aging study. We awarded a contract to the University of Southern Maine, the Catherine Cutler Institute, to conduct the 2024 Maine aging study. The Maine aging study consisted of focus groups, listening sessions, a statewide survey, a caregiver statewide survey, key informant interviews. So we really wanted to hear from the people, the public, about what is working well in their communities and where are those opportunities for improvements. So the statewide survey was very comprehensive. It was quite lengthy survey, but it was very needed. And it touched on a variety of domains ranging from housing, transportation, employment, also care needs, and a whole variety of topics. After they conducted the study, from October to December, USM was very busy analyzing and looking at the data and seeing where there are correlations and finding what those themes were. In December of 2023, they presented those preliminary findings in a draft report to the advisory committee so that the advisory committee could start developing those goals, objectives, strategies, and outcomes that are data driven and really informed by that needs assessment process. So in January to February of this year, 2024, we convened a series of meetings with the advisory committee to go over the goals, objectives, strategies, and outcomes that are outlined in the state plan. In March of 2023, we submitted a draft for preliminary review by ACL to see if did we hit the mark? Did we miss the mark? Where are items that ACL thinks that we need to improve in order for us to be successful in getting that approval for the state plan when we submit? We did receive about 10 comments in total about areas where they wanted some clarity, and we also made some adjustments to the state plan. So it was really important to have that preliminary review by ACL, just to make sure that we're meeting ACL's expectations. The Yes, I am also gonna drop in chat. Thank you, Karen, for including the link to the needs assessment. I also provided a copy of, or a link to the full draft of the state plan on aging, as well as a link to the copy of the slides as well. So those are posted on our ODES website. In April 12th is when you saw the announcement go out through our listserv about the draft of the state plan on aging, and also when the public comment period started. The public comment period is required to be 30 days per the new OAA rules that were issued I think a few months ago. Tuesday and today were the public hearings. We are going to be accepting public comments until May 17th. Then we are going to provide formal written responses to that. And then we go through the approval process. So the state plan on aging needs to be signed by our director of the office, as well as the commissioner for DHHS. And ultimately, the governor of the state of Maine needs to sign off on the state plan as well. So that's going to, that approval process is going to be through June. And the deadline to submit a fully approved and signed state plan on aging is July 1st. So you can really see it takes a full year to develop the state plan on aging. And honestly, that was a little bit of rushed. In 3.5 years, we want to start a little bit earlier to make sure that that needs assessment process has that time to breathe. And so yeah, it takes a lot of effort and initiative to develop a state plan on aging. And we could not have done that without our advisory committee, which included our 5 area agencies on aging. So as I said, a link to the full needs assessment report is again provided in the chat, and a draft of the state plan is also provided in the chat, and it's also on this slide as well. When the advisory committee was first even looking at the developing those needs assessment protocols, we really started at what are the expectations of ACL for states to develop a state plan. So every 3-4 years, ACL issues what they call a state plan guidance letter. And in that state plan guidance letter is a pretty comprehensive overview of what ACL is expecting in each state plan on aging. In 2023, ACL also issued a state plan guidance equity component to really spell out the targeting of services to those of greatest social and economic need. So one of the tenets of the Older Americans Act is the eligibility for these services is pretty low. Means testing and income, which includes income and asset, is strictly prohibited for Older Americans Act funded services and programs. For the most part, age 60 is really the eligibility criteria to be eligible to receive these services. There are a few exceptions, like nutrition services. For home delivered meals, the individual needs to be homebound, as well have an impairment in preparing or making their own meals. Another exception is the family caregiver services. That is 55 for older relative caregivers, meaning kinship caregivers, the grandparents raising grandchildren. That is 55 plus. But it's also for caregivers of any age taking care of an individual 60 plus. So there's slight variations, but the eligibility criteria is relatively low compared to our main care and our state funded programs. But there's not enough funds to serve all older adults in each state. So the Act instructs states and AAA's, area agencies on aging, to target the services to those of greatest social and economic need. The equity complement letter really spelled out in greater detail what ACL's expectations around the targeting of older American Act services and programs to those populations. Outlined in the first letter, there are required focus and topic areas. The five categories are the core programs, which that's the Title III-B, C1, C2, D, and E, as we've reviewed on the previous slide, and as well as the Ombudsman Program and Legal Assistance Program. Another topic area that ACL wanted all states to address was what they call the COVID-19 impact. So as we are coming out of the COVID-19 pandemic, ACL wants states to outline what were those lessons learned during the pandemic that states and AAAs want to implement on going forward. And also, this is where emergency preparedness is a large focus on that as well. The third category is equity. I think I just covered that, and that's really spelled out in that equity complement letter. The fourth category is expanding access to home and community-based services. When ACL uses the term home and community-based services, they mean the very broadest definition of that. That includes Older Americans Act, Medicaid, and state-funded programs and services. So the AAAs are really that entry point into that aging and LTSS network. So ACL is wanting to know about integration of how the AAAs are integrated into that larger network. And the last required topic area is around caregiving. This is coming out of the National Family Caregiver Strategy efforts and the recommendations that are part of that as well. So ACL wants to see how states are implementing those recommendations, which is part of the Maine State Plan on Aging, the proposed one. From the statewide needs assessment, there's a whole section, and please feel free to go read through that report. It is comprehensive. One of the things that USM found were really strengths, weaknesses, opportunities, and threats. So on this slide is highlighting those threats and weaknesses. And they categorize these based on relational needs to physical needs and from quality of life needs to essential needs. So they really map this across that quadrant, and you'll see that the needs of older adults is quite comprehensive, from housing, transportation, preventative care, economic security. Again, it's really important to understand about the scope and focus of the State Plan on Aging. While we may not be able to address all of these areas in the State Plan on Aging, we definitely need to understand what is our role in this. The next slide is the strengths and opportunities. And the opportunities are in bold. And this is where USM found across all needs assessment methods, meaning the focus groups, the listening sessions, the surveys, the key informant interviews, they found some salient themes across all modalities, and those are bolded. And so, again, the needs span across all domains. Based on those findings, and also the state plan, the Maine aging study was also helping to inform the cabinet on aging work as well. So we were doing some double duty with that study as well. So using the findings from that, the advisory committee and O's proposes the following for the 2025-2028 state plan on aging. There are 3 goals, 28 objectives, 100 strategies, and 102 outcomes. If you look at the current state plan on aging, you will notice that this is quite a growth in the number of strategies and outcomes. And that is a result of the increased expectations from ACL. We are seeing this across the nation in state plan on aging. ACL wants states to be more detailed and more expansive. So if you do a comparative analysis, you'll see that, yes, we did grow the number of strategies and outcomes, but that is a direct result of those guidance letters that I reviewed earlier. The 3 goals as part of the proposed state plan on aging. Goal 1 is to support older Mainers and their care partners to remain active and healthy in their communities of choice. The second goal is ensure Maine's aging services and programs are accessible to all older Mainers and their care partners, with emphasis on older adults with the greatest social need and economic need. The third goal is prevent and improve response to abuse, neglect, and exploitation while preserving the rights and autonomy of older Mainers. On the following slides, I will provide a breakdown of the categories of strategies and objectives. We don't have enough time to go through all 100 strategies and 102 outcomes, but we did categorize these into larger buckets of topic areas. And you'll see that there is an alignment with the required topic areas and the categories of objectives. So under goal 1, we have strategies, outcomes, strategies, and objective strategies and outcomes for Title 3B, which is supportive services and community centers for older people. Title C, the nutrition services. Title 3D, evidence-based programs. Title 3E, care partner services. The next category is assisted technology. So ACL awards what they call the Assisted Technology Act grants, and the entity that it receives those awards is Maine Site, which is part of the University of Maine, Augusta. ACL also requires coordination with the assisted technology grant entity in each state with the State Union on Aging, which is ODES, and the 5 area agencies on aging. So we have we outline how we're going to coordinate those efforts in the state plan. Advocacy is another bucket. We are charged under the Older Americans Act, both the ODES as the State Union on Aging and the AAAs, to advocate for the needs of older people when laws, policies, and initiatives are being proposed. So there's that advocacy component as well. This is also where we're definitely advocating to end ageism as well. So we outlined in the state plan how we plan to do that over the next 4 years. The next category is integration. Again, this is going back to that required topic area about expanding access to HCBS service, HCBS. And as I mentioned earlier, there are objectives around coordination with Title III and Title V, as well as Title III and Title VI, which is Title V is the CSEP program, and Title VI is the Native American programs. And the last subcategory of under this goal is the emergency preparedness. So it's not only how the AAAs are going to be prepared for things like natural disaster events, which seem to become more common nowadays, but it's also about how ODES as the State Union on Aging is going to be prepared for similar events as well. Under Goal 2, there are 4 subcategories. The first one is partnerships. The Aging Network, cannot serve these populations of greatest social need and economic need without partners in the community. So we're outlining how we're partnering with those ethnic-based communities across the state to make sure that the needs of those older adults and those subpopulations are prioritized and heard and are part of the delivery of the services. The next category is a requirement as well under the Older Americans Act is trauma-informed services. So ACL is really putting focuses on this in the recent guidance letter, and it outlines how we plan to strengthen our services to be better trauma-informed. Another requirement is screening for brain injury. So we are partnering with our counterparts and within ODES in the services or the disability services section as well. There's an initiative to implement an online brain injury screening tool. So we definitely want to implement that as part of the aging network. So integration between, again, that required ACL grantee coordination efforts. And the last category is program monitoring. So as we conduct outreach and we collect data on the needs of individuals with greatest social and economic need, how are we monitoring our programs and services to know that we're actually meeting those needs? Under goal 3, there are 3 subcategories. As I mentioned, the legal assistance program, which is administered by the Legal Services for Maine Elders. The second category is the Elder Justice Coordination Partnership and the Elder Justice Roadmap. And the last subcategory is the State Long-Term Care Ombudsman Program, which is Maine Long-Term Care Ombudsman Program. So as part of this each state plan on aging, ACL is requiring states to define what is greatest social need and economic need. So this is copied directly from the recent OAA final rule and it is part of the proposed state plan on aging. So whenever there's a reference to greatest social need, these are the non-economic factors that we mean. It's important to understand that this is including these, but is not exhaustive, meaning if you look at the very last, any other status that restricts the ability of an individual to perform normal or routine daily tasks or threatens the capacity of the individual to live independently. So there is an other category that states and AAAs are allowed to define in greater detail, but this is the general basis of the definition for greatest social need. Greatest economic need is defined a little bit simpler. It is the need resulting from an income level at or below the federal poverty level. Like once again, Older Americans Act services are not means tested, but we are to target those services to those with greatest economic need. So when people call in for services and register for the programs, we do ask for income information so that we know that our outreach strategies are effective. And that's why we really collect that income information. And again, the federal poverty level is using the standard federal poverty level definition, which is defined by the U.S. Federal Poverty Guidelines. Another part of the state plan on aging is what we call the intrastate funding formula. Earlier, I mentioned that each state receives the grant awards based on a formula that is called the interstate funding formula. And again, that's population based. Each state has to develop what is called an intrastate funding formula. And that has to be spelled out as a mathematical statement, which is provided here on the screen. And it also states are required to define what that mathematical statement means. So each time that ODES receives a Title III grant award, we use this formula as the way to determine how much each area agency on aging receives as part of those grant awards. The targeting criteria are 4 categories: age, greatest social need, greatest economic need, and rural. You'll see that age, greatest social need, and greatest economic need are equally weighted at 30% each, with rural being 10%. This is all the population data that is used to determine this formula is largely through the US Census, so it's a reliable, reputable data sources. What is changing from the current IFF to the proposed IFF? Equal weights were given, as I just mentioned, to age, greatest economic need, and greatest social need. And that included some adjustments as outlined on the screen. Rural decreased in order to make the equation balance. Rural decreased from 15 to 10%. Greatest social need includes the addition of a few subpopulation that includes individuals who are 60 plus who live alone, and individuals living with HIV/AIDS, as well as individuals 65 plus with Alzheimer's disease or living with Alzheimer's disease. Based on input from the 5 area agencies on aging, there were 3 additional populations included that are the top 3 chronic conditions for individuals ages 65 and above in Maine, according to the National Council on Aging. That includes hypertension, hyperlipidemia, and arthritis. The base allocation was also modified to increase from 15% to 20%, meaning that 20% of the grant award is split evenly across the 5 AAAs, and the remainder is done based on these categories of age, greatest social need, economic need, and rural. Using updated population data and the modifications to the IFF, this is an illustration of the agency percentage changes that per AAA that is also found in the proposed state plan on aging. A more recent requirement of ACO is that states have to spell out using actual grant awards how much each AAA gets per subpart. So this is also spelled out in the state plan on aging. It's important to understand that this does not include the nutrition services incentive or no, nutrition supplemental incentive program, which is funds that each state receives and AAA receives to buy domestically grossed food. And it also does not include the state funding, and both of those are awarded mostly by the IFF. There are a few exceptions. The table that's on the screen is just for the Title III-B, C1, C2, D, and E grant awards. It's also important to understand that this is not illustrating the required match that is part of the grant awards. Lastly, towards the end, this is in one of the attachments of the proposed plan. I think it's an important piece as well. Included in the contracts with each area agency on aging, there are minimum proportion requirements for Title III-B specifically. 20% of the awarded 3B funds must be spent on access services. So this is largely funding the Aging and Disability Resource Centers that I mentioned earlier. 10% of 3B must be spent on in-home services. That includes services like homemaker, personal care, chore. And 10% must be spent on legal assistance. This is where each area agency on aging has a contract or a sub-agreement with Legal Services for Maine Elders to provide that statewide legal assistance. So that concludes our summary of the proposed state plan on aging. We would like to now open it up for public comments. Once again, written public comments can be submitted to directly to me to my email address until May 17th. And now we would like to open it up for the public comments portion of it. Once again, however you're most comfortable to provide those comments about the state plan, you can do that in the chat feature, or you can also take yourself off mute and provide that verbally as well. Once again, it's important to remember that ODES will not be providing responses during this public hearing to questions or comments submitted. Instead, we will be collecting that and providing a formal response in the final version.
Is this when we can submit verbal
Yeah.
comments?
Yeah, absolutely, please.
Yes, hi, this is Steve Wade. Thanks, James. This is Steve Wade. I'm the executive director for the Brain Injury Association in Maine, and I just wanted to comment on the screening for brain injury, and just to, I guess, reemphasize that it really is an really important issue. The Maine CDCs periodically will run hospital discharge data, and right now older adults are have the highest incidence of brain injury in Maine. A lot of it is fall related, and unfortunately, a lot of it's missed. I think the last time I saw the numbers, there was over 1,000 that were actually identified through hospital discharge data. But again, I think many older adults were missed because the focus oftentimes at acute care is on the orthopedic injuries, and many times the brain injury is missed, particularly if it's more of a concussive related brain injury, and sometimes can be mistaken for dementia. So again, just putting our 2 cents in that this is an important issue. The Brain Injury Association certainly would be willing to help out in any way. We actually have resource navigators in the state specializing on opening the door sort of to the brain injury community of care, and I saw that one of the key essential needs was around better service navigation. So maybe perhaps establishing a linkage between the service navigators within the brain injury community and some of the older adult agencies or the area agencies of aging. So, but I'll submit some written comments with some ideas. But I just wanted to again raise awareness of the issue of traumatic brain injury in older adults. Again, how it's often missed, and how if we can identify it early, we can really prevent it from being much more serious injury. So thank you very much for the opportunity to and a really excellent presentation. Again, thank you very much.
Thank you so much, Stephen. And I look forward to those written comments as well. So yes, this is the portion where if you have any comments, we would love to hear them, either through verbally or in the chat, however you would like to submit them. We are scheduled until 11:30 for this public hearing, and we understand that it is a lot to digest with the state plan on aging. So we will hang out here if you're still trying to process all this information and formulate your comments. We totally understand that, but we will definitely be hanging out. Thank you, Kristen.
For those again who have joined us and are staying on the line, as James has said, please feel free to jump in, take yourself off mute if you have comments, or put them in the chat. And of course, we'll be taking written comments through May 17th with James' email address on the screen.
Hello, my name is Danielle Nelson. If you can all hear me.
Yes.
Okay, great. Thank you.
Hi,
I'm
Danielle.
the administrator of Blessing Hands of Maine LLC. We are located out of Washington County now in Millbridge. We do serve Washington, Hancock, and Penobscot County. We do in-home care for a few different waivers. We've actually recently been approved for the add-on of Section 21 and 29 for intellectual and autism, which is very exciting. But I just want to speak on behalf of the caregivers and the supports of the people trying to stay in their home, right? And our biggest, first of all, I want to say thank you. This is a wonderful presentation, and I have really enjoyed the information that you have provided. We've been looking forward to this as it is very important to us that we can grow with, as society is growing and things are changing. But the biggest thing that we find that I think some of these resources are going to be great for is, the caregiver turnover, the caregiver burnout, even the loved ones. We have many loved ones that care for their family members through our agency. I myself have done it for 16 years for loved ones. And I'm really excited to see what this State Plan Act, Plan of Aging, as it changes over these years, the quality that we can provide, whether it be resources, supports, and different things like that. So I didn't really have an amazing speech planned or anything particular to say. I just wanted to say on behalf of our agency what it means to us that what you're all doing, and that quality is very important. Our biggest struggle is having enough staff, having employees and people being committed in that work ethic, but then also those that are with us, not getting them burnt out because they're doing such great hard work. It's really balancing that for us, and so we're excited about the resources that you provide. Thank you so much.
Thank you, Danielle, for providing those comments.
Thank you, Jay. Look forward to the comments.